Okay.
Kelly, are you getting us started this morning
Sure
or
will.
this afternoon, depending on where you are?
So thanks everyone for joining. First, by way of introduction, we have some guests with us today to have a dialogue around funding. And that, in case anyone doesn't know, Eric Bruns and Mark Wiest, and we'll let them say a little bit more about themselves here in just a couple of minutes. As always, we just want to kind of start the time off together with a chance to take a collective deep breath, I think. We've done some grounding activities in the past, and today I thought we could just take 1 minute to do an activity together that is really asking each of you to take a moment to express gratitude to someone else. So Susan, I think that's on the next slide. Oh, no, first we said summer plans in the chat. All right, people could do that too. If you could please just send a text message or a quick email telling someone thank you or a note of appreciation. This is one way for us to actually take care of ourselves. And I'm hearing a lot these days, and I'm sure you are too, especially about people feeling exhausted, fatigued, chronic stress kicking in. I know that our educators are overloaded and we're all just trying to get to the end of the school year. And I know that, showing appreciation and gratitude is something that is welcomed and also makes us feel better when we do it. So I'm just going to stop talking and give everybody a quick moment. Okay, if you didn't get a chance to finish, wrap up your message, please, so we can dig into our content. And before we open it up, Susan's going to go over a few things related to funding. Would love to hear what are some of your summer plans. I do find that if I'm feeling really stressed out or overwhelmed, I like to look ahead to the calendar for when's the next time there's a little bit of a break or start to plan some fun things to do. And then after that, I actually want to inquire. I actually have a technical question about anyone who has schools positioned to complete the ISF implementation inventory. There's just a little bit of curiosity about that. So let's hear about your summer plans, and then we'll get into some business.
Thanks, Mark, for going to the Outer Banks.
Big Island of Hawaii as well.
Oh, I was like, where's the Bib
Probably
Island? I was like, I have to know about this Bib Island. Okay, yay.
Oh, did I say Bib? Oh, geez.
Yeah. No, that's awesome. Cuba, Trisha, nice. Outer Banks, boating. Jackson Hole, oh my gosh, these are awesome places. And isn't it amazing to be vaccinated? I'm so thankful for the science and for the vaccination. I feel like I've got magic powers. I just actually booked a trip. It's not a summer trip, but I'm going to surprise my mom for Mother's Day.
Oh, nice.
Yeah, she's in Richmond. I'm in California, and I haven't seen her since Christmas of 18, 19. What year is it? A really long time.
Yeah.
I'm just hoping she doesn't have any plans for Mother's Day because I'm going to be showing up at her doorstep. She'll probably be off to the big island of Hawaii, Mark. Oh, all right. Thank you. I'm so happy that we all have plans and so much to look forward to this summer. And I do the same thing, Kelly. I look at my calendar I was doing that last night. I was like, what do I have next week? All right. So let's get down to a little bit of business. All right. I have to switch my video placement because it's in the way of being able to advance my slides. Does that ever happen to you guys?
Yes.
Oh, gosh, where are you? Okay. All right. So Kelly, I don't know if you want to talk a little bit more about this.
Yep. Thank you. Yes. So just super quick, you know, obviously we all spend a lot of time talking about database decision making. And although this was not a typical year, and maybe there aren't going to be opportunities to collect data in the same way, if you feel like you have schools who are ready to assess their interconnectedness, let us know and we can walk you through that process. I know some of you already have schools who've completed this at least a time or two in the past, and some of you might have schools who are ready for a baseline assessment, or others who are a little farther along, and some of you might not be ready for this at all. And I certainly appreciate that, you know, this might be a bridge too far this spring. So I just wanted to kind of put it out there. You can, you know, shoot me an email or get in touch with Susan or Kimberly or anyone else from our teams if you're interested, and we can help you get that squared away. That's really all. Just a prompt. Okay. Thanks.
Sure. And just one other note. I recognize, again, this was an unusual year, but we are putting together some newly designed scope and sequences. And I know that several of us are involved in working with different states and different scope and sequences, but I'm wondering if that might be something that we share in a future meeting as we're trying to figure out kind of the pacing moving forward. And we're trying to figure out how to pull out kind of the essential components that are really needed and necessary right now. And I know that things are progressing really quickly. There's a ton of resources out there, and it's much more about curating resources, I feel like now, than kind of being innovative, because we're drinking from a fire hose. But I'm wondering how we might be able to pull some of the things that we're all doing independently at states and pull them together and kind of learn from each other in the scope and sequence arena. And I'll let you guys come off mute if you have any additional considerations to be thinking about or needs at this time. Okay, I'm working on my wait time. Hearing none. Okay. So we wanted to talk about funding and just to kind of do a couple of setup pieces and offer some slides that you might want to take back as you're talking with your teams about ways that we spend funding. We are really concerned right now that with all of the money kind of coming at us pretty quickly, there will be a couple of decisions that will be made that result in buying stuff and having it sit on shelves, or not being able to sustain things. So we just want to make sure that we've got the implementation framework in mind for making decisions about how we're going to spend it, and make sure that we are investing in ourselves and the capacity building efforts that we know, so we can really sustain those practices moving forward. And that's really hard when money's coming at you really quickly. Things are happening really quickly on the ground in terms of needs and us getting overwhelmed. And we really need to pause right now and make sure that we don't squander this time and waste money. And that's really hard to do. So we wanted to provide some guidance today. Kelly, do you want to repost that that document that I offered in the beginning? I don't think everybody got that. But we're seeing a lot of different centers put out guidance documents with respect to funding. And again, we just want to make sure that as we talk through today, that we consider that we've got a little bit of time here. We've got about 3 to 4 years to spend down this money, and we want to be thoughtful about it. We want to make sure that it's guided by the core features of the implementation framework. So again, we're happy that money is getting dedicated to things like hiring more social emotional experts. There's a lot of conversation about social emotional curriculum and SEL. There's a lot of conversation about trauma-informed practices and getting training in that and getting trained in youth mental health first aid. And there's a lot of discussion about bringing and paying, thankfully, families and community partners to serve on teams as we ask them to work with us side by side. And while we're all giddy about that, again, we've got to recognize that those core features really help us incorporate and infuse those implementation framework features in, oh gosh, that didn't make sense, that we use the core features of MTSS to guide that, yes, these are good, but they have to be situated in a redesigned system. So yes, we want to hire social emotional experts, but we really need them to participate across all tiers of support, particularly around the prevention and promotion of mental health literacy right now, and help us coordinate the activities in tier 2 so we don't get completely overwhelmed and fall back into old patterns of really working with one student at a time. So it's really about hiring those experts, but then repositioning them on teams and then pushing them into the classroom, pushing them into making sure that we're building capacity of all staff to kind of lean into their role that we're asking them to do. And this is something they have not been trained in. And so when we ask our staff to kind of be taking more of a role in the mental health space or the social emotional space, we have to recognize that that might be a challenge for a lot of them and be really crystal clear about what we're expecting them to do in the classroom. Yes, we need to hire social emotional curriculum, but how do we, again, bring our clinicians to the table, make decisions together as a team about prioritizing that data? How do we make sure that we are delivering new training, that we give folks time and space to figure out how to pull that new content and apply it into their strategic planning work? And then, yes, let's strengthen partnerships, but let's make sure that we differentiate, again, the roles that they're going to serve on the team and make sure that we are giving space and to kind of comb through all the terms we use and understand the system and make sure that we keep our partners at the table because they have a sense of belonging to the team and they're not just tokenized as members of the team. And so we're really hoping that the steps we offer in a lot of the guides through the Interconnected Systems Framework are really helping with that. Any other comments, Kelly, or anybody else for that matter on the slide as we really think carefully about how we spend these dollars?
Susan, could you say these dollars? So you have more knowledge than me. Kelly told me about this elementary, secondary school emergency relief dollars. There seems to be a wide variability in understanding because when I talk to local collaborators here, they're not talking about those dollars. So when you say these dollars, what do you mean?
Yeah, the emergency relief dollars that are coming into to states right now that are supposed to really quickly, pass-through dollars funneling really quickly down into the schools. So let me, let's do this. Let me pull this up this was a new resource that Brandy Simonson shared. Sorry, I'll share back in a second, hold on. Thanks, Kelly, for putting that in. It's a great question, Mark. Thanks for stopping me because I think everybody has a different sense of this because states are really handling it very differently. So right now there's a ton of money available that's earmarked for K-12 ed, and they're obligated to use it in some way, but I don't think that, I think there's a there was a webinar from CEC and they offered that we've got a little bit more time to spend down the dollars. So I think that there's wave 1 of the funding that came in that needs to be spent by, maybe that's a September 30th deadline. And then there's a second wave of funding that's going to go into schools and districts. But every state seems to be operating a little bit differently in terms of how they're passing those dollars through to the schools and school districts. And so while this might be outside of our decision-making authority about how the dollars are going to kind of roll in, I want us to be in a position where we're prepared to have dialogue and conversations with maybe a school, a principal that's sitting on $1 million all of a sudden, and really thoughtful ways of spending that down. Or it could be that you're working in a district or an ESD level and they're getting the dollars. And I want us to be in a position where we're called in to talk about how to spend that, to have conversations related to how do we invest in ourselves? How do we just not throw these dollars away? So this was a guidance document offered from the Center for Learner Equity. And I thought they did a really good job of breaking down specifically for students with disabilities, but and really distribute it in an equitable way. So these are the dollars I'm talking about, Mark.
Okay.
And I don't know if anybody else has anything to share related to or you were on that CEC webinar, which I thought was good, but for whatever reason, I'm blanking on any kind of critical information I took away from that. Because anybody want to chime in or say something that I've missed or provided additional detail?
Susan, I don't have any additional detail, but in Delaware, we are faced with scrambling to assemble a proposal at the state level. So there will be, the LEAs will get funding, and we certainly want to help them make some meaningful decisions about how they use their funds within a framework. But we were proposing initially to do something that was more systems-based and concentrated. However, we have to also address statewide need. So, and Sarah's been through this torture right now. I think that what our challenge is to provide, and we're using implementation science to guide what we're suggesting, but what we're trying to do is present, what is readily available, or what can we provide to all districts, charter schools, statewide, but then based on a level of readiness and capacity at a specific school level, what we are able to do, and then certainly what we want to do at the LEA level. Mm-hmm. So I think there's going to be some pressure, though, from politically to be able to provide interventions. So this is really timely, and I appreciate the resource that you shared. And if I can digest it in the next 15 minutes and get it back out to a director, that would be great. But anything that anybody has any ideas about, we really are struggling to get this. We've revised this proposal several times, and we're struggling to get it to the point where we can tie a bow on it and submit it to the governor by next Friday.
Okay. And not to put you on the spot, Eric, but I know at OSPI, and I don't know if you've read through their guidance documents, but OSPI in Washington State just put out guidance, and 80% of it is good, but unfortunately the 20% that's not good is really not good. So what they've done is they now have a wellness assessment, and so they're putting rigorous accountability metrics in for a wellness kind of score, if you will, and they're conflating diagnostic with a screening tool. So yeah, that's unfortunate, but the rest of it outside of that is really good, and I think it's on the website, and I can put the link to that in the chat box for you. But like I said, be really careful about that one piece.
I'd feel free to put that up. I think that it provides an example of one state's approach, and regardless of the content and the mix of good and bad, it provides kind of a little bit of a example of a framework if there's other states that are still in that kind of phase of pulling together what the expectations are going to be, which is my understanding. So these are the expectations on the LEAs around what they need to kind of commit to or sign on to do in order to receive the resource. Is that correct, Susan?
Yeah, they have to submit a teaching and learning plan that focuses on academic and wellness supports.
Yeah.
So that's great, right? They've got kind of this equal priority for it, but in doing so, they're using screeners and diagnostic assessment, and they have ACEs as a screener. So there's some really big hiccups with that section of the document, or even the tools that they're talking about, you know, and I would prefer having them kind of separate those measures out. And I think it would have been helpful had in the wellness scoring, I think we should be talking about school climate and school surveys and kind of triangulating a set of data that gives us kind of a wellness profile. And they didn't really go into all of that. But I think from a template standpoint and from kind of giving really good systemic guidance, I think it's actually pretty decent.
Mm-hmm. Yeah, I mean, my experience so far has been that you have state agency folks, not just from education, but also from health, scrambling to put together a proposal to legislators who are in budget meetings. And literally after this incredible flurry of activity around ideas coming from all sides, apparently they all got kind of put into a mix of proposals, and their legislators went into a cone of silence to kind of decide how they would allocate some tens of millions of dollars to the different ideas. So this is seemingly how the sausage gets made, is you've got state education agencies, again, correct me if I'm wrong, with, you know, sets of rules around passing through dollars directly to the LEAs, and then you've got agencies asking, how can we invest some of these resources in kind of statewide plans? And some of the things that were thrown out there, and this is just a small number, were we have a statewide partnership access line. So folks at our Seattle Children's Hospital who are available to provide consultation to primary care physicians primarily about how to prescribe, how to best refer for kids who and families who come through their office with behavioral health needs, recognizing that they're not the experts, not specifically trained on those kinds of you know, how to respond to mental health. So our state has this line for primary care physicians, and the proposal was, let's rapidly scale that up to be available to school staff and fund that. Another kind of big silver bullet that people look to seems to be screening, right? So how do we just do universal screening? And again, it comes back to this question of how do you figure out how to get the state reps, the state agency folks, the legislators to kind of think about this in context of MTSS, which is really difficult. I mean, we have legislators who are actively opposed to MTSS for reasons that aren't really that clear, usually because they have some sort of other kind of acronym model that they've been promoting for some years. So yeah, the huge challenge is to, you know, how can you allocate these dollars, whether to LEAs or to statewide kind of infrastructure, in a way that actually attends to the overall context of the MTSS framework. It's been very interesting. I could give a couple examples of ways we've tried to, you know, frame that discussion, but I don't know how helpful it would be. Like I was on vacation last week and throwing together these frameworks while kind of in a van with my family. But I'll show you one if you want to let me share screen just real quick, ways of trying to kind of pull those different ideas into something that at least moves it more towards a comprehensive strategy rather than a silver bullet.
Sure. I think you can share, Eric.
So just real quick, I won't even bother to figure out how to do the screen sharing or the presentation mode, but we had again legislators who were coming to us saying, how can a SMART Center, so our School Mental Health Assessment Research and Training Center at the University of Washington, just get everyone to do universal screening? It's like, okay, not a bad idea. How do we promote that? But how do we promote it in a context that will actually be effective and not run afoul of, you know, this concern that's really well base that you're screening without a ability to respond or refer or triage to some sort of resource, right? So we kind of put together this thing, and we were trying to use any opportunity we could to educate folks about just how interconnected these kinds of activities need to be, and framed by the MTSS model. So, okay, yes, what if the Smart Center put together a web-based resource inventory? All the districts had the ability to spend as needed to select the screeners that were most relevant to them. And we would work with our 9 education service districts and the mental health experts in those districts to then give you consultation on how to use those screeners in an effective way. But, and I don't know what the outcome is going to be because they're still in the cone of silence, we also need to expand the school behavioral health provider pool. And some good ideas came out about rapidly mobilizing telehealth resource and training programs to provide more folks available when kids are screened as needing an immediate response, and potentially, again, using our network of educational service districts and the Smart Center at the hub, how could we train counselors who we know and ISAs in schools to use efficient evidence-based stepped care models. And a lot of the examples that a couple legislators really latched onto were the Sonoma model. I'm always wondering if Susan is familiar with the Sonoma model, given your geographic proximity.
Unfortunately not.
The people, just so a few people got wind of this model that was used for families in the wake of the wildfires, whereby public health was identified mental health workers, and through the schools had each school reach out to every single parent to say, if your child has a mental health need, we now have the resource for you to self-refer, self-nominate your child. And if so, complete this screener. And here's where it gets messy. Okay, great idea. If you had the resource to try to figure out how to do universal screening, maybe even reach out to parents from the school, a trusted source, but the screener they used was one that was trauma-based and ACEs-based, which makes sense in the wake of a massive wildfire, but would it make sense in COVID? So these are the kinds of messy things that are happening in our state.
Thank you, Eric. Any questions? Any other folks want to chime in about the complexities they're dealing with right now with this money, and maybe involved in the guidance, writing of the guidance like Linda is? Are you going to be working all weekend, Linda?
No, because Sarah did so much on it already. So actually the reimbursement for telehealth was something that was suggested. So the LEAs are going to get their own money. And I think what we're talking about right now is $2 million of funding initially. But so Delaware is very small, so don't laugh anybody, please. But there are 19 large districts, or districts, I should say, and then there are charters to equal 43 LEAs. So when you have $2 million and you have 43 LEAs, that's not really a ton of money. My worry is, as an education agency, brokering, medical services. So we are partnering with the Division of Prevention and Behavioral Health Services, and with our AWARE grant, they have direct work, but I'm a little bit challenged about coordinating the telehealth from an education agency perspective. So I'd be happy to hear if anybody has had good success with that. I think that there probably would be interest in it.
Yeah, I'm really interested in our state, whether or not there's any traction that comes out of the cone of silence around investing in telehealth and providing resources to these training programs or other sources of actual behavioral health support for students that get identified. But I think I think you already referenced this, that it seems like it's going to require partnership and collaboration with your behavioral health and health agencies in the state. Long term, we've always been pushing for changes to our state Medicaid plan to allow providers to be reimbursed for going into school meetings for the travel required. It just doesn't get any traction. So one question I have, and I don't have an answer, is that can these short-term funds be used to kind of kickstart better reimbursement, or just flat out kind of block granting to providers that are connected to these schools, buildings, and districts, to whether it's through telehealth or in person at some point, actively participate as a member of the school team, and be present in those school meetings and be part of the tier 1 work. How do we mobilize these dollars to bridge that gap that just seems to have been ever present in trying to do, as my colleague Mark Wiest coined the term, expanded school mental health, right? I just remember in Baltimore City, when I was there with you, Mark, going into the Baltimore City Public School building, into a basement room full of folks on computers, trying to get reimbursement for every dollar that they could through the Office of Third-Party Billing. But that was a way of recapturing dollars. My memory was that it was an expectation that X number of providers would be available to schools and they could be part of those teams. And that requires funds to kind of upfront pay for them to do whatever it takes to serve the school and its students. And then you do your best to mobilize some sort of force to recoup as much Medicaid and insurance dollars as possible. Isn't that kind of the way it worked, Mark?
Yeah, you're sort of stealing my thunder.
That's what I've been trying to do for 20 years, Mark.
Can I jump in? Is that all right?
Yeah, go for it.
I think there are 5 conversations to me. One are the overarching principles, vertical collaboration, state to district to building, horizontal collaboration, making sure we're emphasizing interdisciplinary collaboration, involving stakeholders, especially youth families, all the principles, the core MTSS features. The second conversation to me has to do, in my mind, is workforce related, role analysis, role empowerment. For example, we know school psychologists primarily doing testing in many districts. They could do much more than that. School counselors primarily doing academic advisement. They could do much more than that. And Eric mentioned this, the recruitment issues are critical. There's not enough of the mental health workforce. So we have a grant under review right now with the foundation for a 3-pronged strategy to build up the school mental health workforce. A, recruit clinicians from mental health systems into the buildings, and there's a whole strategy with that. B, recruit school employed folks, counselors, social workers, psychologists. C, recruit paraprofessionals like community health workers. And there's a strong evidence for community health workers as promoting broader health promotion efforts. We don't have those paraprofessional staff in schools for the most part. We think that that's an important strategy. So there's a lot around role analysis, empowerment, workforce. And then the third area for me would be, what are the core funding strategies that we've been using that we need to strengthen? So Eric alluded to, and this connects to the ISF District Community Leadership Team, that ideally at a district or community level, you have a group that has authority grading funding, and I saw that in Eric's example, across organizations, and then allocating that to grow the school mental health workforce. And as Eric mentioned, in Baltimore, one thing that they did was they significantly invested in the Medicaid in the schools billing office. So that office, I'm making the numbers up, back in 1987, brought in $200,000. By 94, it was bringing in $5 million. I made those numbers up. but then they protected 10% of the revenue that came in to go into a contract mechanism to bring the clinicians in. And so that's very consistent with our writing around the Interconnected Systems Framework, Memorandum of Agreement. These core things are really absolutely essential. I think another thing from the pandemic, we're realizing one of the maybe silver linings is we're working better across systems. For example, we know we've got the education mental health connection, but what about child welfare and justice, right? And they have funding. Those kids have mental health needs. Those kids are in schools. Title IV-E, for example, is one of the funding mechanisms that we were exploring from child welfare to strengthen the school mental health array of funding. Another thing in that core approach is for districts, as the biggest youth serving system in any community, it's going to be your schools. How are they utilizing their dollars? How are they utilizing the Title I? How are they utilizing safe and drug-free schools? The memorandum of agreement, for it to work with the community mental health system, has to pay for at least a day a week of the clinician's time for a full-time clinician, or they're going to be co-located. So, that's another part of it. Then the fourth would be this new funding, and you could put this new funding in with other innovative ideas. So there's temporary new funding. Another strategy that would be kind of innovative or new would be building programs based on cost savings. So we did something in Maryland where we diverted students from alternative placements in the private sector and saved about $3 million from 4 schools in 2 years. And if those cost savings could be reinvested, you would have an exponential growth curve there in funding that you could use. Eric Slade, from Johns Hopkins, who helped us with that work. So that's another example. So new funding, grant funding, innovative funding, how does that build the core? And then the fifth theme would be, as we do that, how do we build the core, as Eric was suggesting, in a way that leads to sustainability of this new money? And enhancements that are made from it, versus we have this funding from 21 to 24, and then it goes back to a different level. That's a very important discussion. Anyway, those 5 themes were the things that jumped out at me.
Thanks.
What's the grant that rolls that up? Is that in South Carolina, like a grant to mobilize that for a state or a research grant?
Which you're referring to, Eric?
Oh, you at the top, you said you had a grant that was kind of referenced.
Oh, it's a South Carolina Blue Cross Blue Shield Foundation. And so that's another angle, is working with the insurers.
Yeah.
Strong advocates. And obviously a big angle, we just had Mark Sander at our school behavioral health conference, which, by the way, we had an in-person component and it went very well. Mark has done a phenomenal job at building relationships with private payers. Minnesota is maybe one of the few states that has done very well with the private insurance. Most states have not. I think that's another really important mechanism.
Mark, Lisa was asking in chat, Lisa's from Michigan, if you have a resource or anything in writing that describes in a little more detail that piece that includes paraprofessionals. Sounds like
I have a grant application I'm happy to share.
Lisa, that might be more than you bargained for, huh? Okay.
I'm happy to share that.
Cool. Thanks.
Just send me an email, weiss@sc.edu.
Mark, going back to one thing that we might be able to provide support around, or at least, I know it's probably past budget season at this point, but you're describing kind of protecting our clinically trained staff to do clinically trained activities. And so maybe having a 2-step or 2 different job descriptions for school counselors. And one might be, more of a clinical trained person, and then the other person is counting the credits, or making that a completely different part of somebody else's job.
Right. Well, so I work with the Army, and they talk about work at the top of your license. And we don't want the clinicians just to be doing tier 3. But, I think Steve Evans did a focus group with school counselors, and they said they're so frustrated managing Excel spreadsheets all day, and they're not even good at it. I have a license and you're making me manage academic scheduling in spreadsheets. What degree do you need to manage spreadsheets and put kids into classes? You know, that's back to that role analysis and empowerment piece. It's not necessarily more funding, but looking at what people are doing and how do we optimize roles away from things that they don't need to be doing or could be backfilled by somebody with less training.
Right, and we've got the time study activity in the monograph, and we also have kind of a staff utilization audit, and it's just asking our folks to track how they spend their time. And I've been on both sides of that, right? I've been a school counselor where I got pulled to do substitute teaching, everything. So if somebody was absent, I got pulled out to do that. But I've also been on the other side where I didn't have a budget as an administrator of a building, and I didn't have a choice. I needed a body, you know, I needed a pulse inside of a classroom, and I didn't have enough staff to go around. So it's got to be pushed back to the district leadership to really kind of drive those changes and make sure that there's a culture where we do protect our clinically trained. Right now, I've got a colleague who's one of the best trainers and coaches out there that's doing a ton of amazing wellness activities, and she's sitting in a parking lot every day running the COVID immunizations right now. I mean, that's because people are just, you know, they're desperate to get people to be able to distribute. I get that, but we should not be pulling clinically trained people to be doing that kind of work when the need is so great. But those are some of the examples I think we're going to be seeing from here on out, because of in the midst of feeling completely overwhelmed by all the activities we have to do. We're like crabs.
I think a related piece, Susan, is mapping in your community, the community colleges and universities, and developing externships with them to create a win-win of an innovative students, usually for course credit, and then expanding our workforce. This at paraprofessional, or we're moving toward the term perhaps MTSS specialists. You think about many of our schools implementing MTSS. Often I go into them, they don't know who's responsible for tier 1. They're all kind of just doing it. Same for tier 2. I think that's another aspect, is accountability and staffing for each tier. Who's involved? What's the work plan? Who are the people at each of the tiers?
I think one thing that would be really useful, if it exists, Mark, would be any kind of guidance on working with managed care organizations or your private insurers to try to build out resource or to maximize the resource that they may have for school-based mental health and wellness activities. You know, our state went to, you know, this model of, you know, integrated care, which meant that they just basically shook the Etch-a-Sketch and put all of the resource into X number of managed care organizations that ostensibly the benefit will be better coordination of substance abuse, mental health services, and so forth, putting it all into individual organizations. They have mandates for prevention activities, you know, and we have, I personally have not found an entree to kind of reinforce just how critical it would be to use the schools as the locus for any kind of prevention activities for young people. Is there any a good resource you know of around?
Well, I think Mark Sander, and he his presentation at our recent conference was videotaped and recorded, so we could share that. I think there's a big issue, the elephant in the room. You know, states have either public mental health systems, private or hybrid, and many states like North Carolina is, you know, I hate to be quoted. And is there anybody here from North Carolina? They were 50th in the nation for the mental health system because they completely privatized it. They had a consent decree, the William, and then, you know, the legislator said, we're out of the mental health business. So they just turned the mental health business in North Carolina over to for-profit managed care companies with stakeholders and shareholders in other states. And we know that the subtext is, you know, they get these very large contracts The reality is the less services that are provided, the more profit there is at the end that they keep. So there's got to be accountability there. That's a big discussion, obviously. In South Carolina, we have a hybrid. The public mental health system does hold the MCOs accountable in terms of, making sure dollars are being spent appropriately. But, that's another big theme.
I think sometimes when we need to kick it up a notch to the state level, the policymakers who, if they're bought in, can think about the leverage points to change the managed care funding structure. I put in chat, that's essentially what occurred in Pennsylvania. Is stakeholder groups like families and educators and even the providers themselves were saying, what we're doing isn't working, it's inefficient and ineffective. And so at the state level, they were able to change the funding mechanisms with some policies to free up dollars for prevention and people to be on teams in schools where they didn't have the client to bill for the time. Mark, a similar thing happened in Asheville. If you remember, shortly after you and I were there, they had their managed care partner at the table from the onset. And again, you've got to have someone who's bought into the idea of a new way of work, who then can take it to whoever the person to control those mechanisms to make the change in the shift. So it sure doesn't happen overnight. And I don't know, Miriam, if you or Catherine if there's anything you could speak to in Kentucky or others for certain as well around those pieces. And I don't mean to put you on the spot if there's nothing either to say.
I'm kind of out of my depth speaking about the private MCOs. I don't really know how. There certainly have not been involved in any of the systemic school mental health work. Now, whether there are individual districts that have been able to create partnerships with them or not, I couldn't say. It from what I hear back from districts, that doesn't generally happen. They have a pretty hard time working with private insurers, mostly. Hearsay only, but that's what I get back. I know we were just recently granted a Medicaid waiver to be able to use the for free care, to expand that within our school systems, but that's Medicaid, not the other end of things. Miriam, do you have more to add?
So I think it's I think there are some providers who do bill managed care on a patient-by-patient basis for school-based services, and some recoup and some don't. And I think some of it's diagnostic driven, and it depends on probably how they bill it. There's a lot of variability in that. It's possible, I don't know that it's necessarily easy, but it's not that districts are creating any relationships in any way. There is Kentucky does have a good level of public connection to and monitoring of the MCO behavioral health work. And there is some leverage there, and it's actually increasing at the moment. So there's actually a lot of moving parts right now happening, but I don't know how it's going to actually shake out. So we'll have to see. And I'm not privy to exactly where it is. I just know there's a lot of conversation happening and shifting. But it is a public-private partnership is probably too strong a word, but I would say connection for sure.
We're talking a lot about the willingness to kind of leverage different parts of funding and bring it together with the understanding that how do we pool funding to focus on prevention and promotion of mental health efforts? And have you had, Eric and Mark, have you all, or anybody, have you had success with having conversations with people who are holding on to their pot of the money and not wanting to kind of give it away? Are there things that you've done that have been successful in trying to pool funding in to focus on promotion and prevention efforts?
Well, Eric and I, when we're in Baltimore, I think, and Nancy Lever would be a good resource for this because she's really deep into the funding. I think it's those collaborative partnerships. So it was on the expanded school mental health advisory board, and they had one coordinator hired jointly, and this is still the case, hired jointly by the school system and the mental health system. And then also adding in the mayor's office, justice, substance abuse agency, and the foundation community. And so it's kind of like they all agreed to be on this advisory. And as part of that, they also all agreed for transparent accounting. Every agency, how much they're putting in, where the funding went, to which schools, to support what programming. I think that transparency in accounting is really, really important.
Yeah, I
So-
don't have anything to add really in terms of secrets around trying to make that happen. The examples have just been few and far between in this state. I'd have to go back to my East Coast days, like Mark is referring to, for any examples. One
Well,
thing
you don't have much, you have a dearth of master's level and above mental health professionals there, right? You have a lot of bachelor's level frontline.
Yeah, there's definitely a workforce. There's a workforce problem here in Washington State.
Yeah.
To be sure. You know, the only thing I could say about prevention and promotion of wellness writ large is that, you know, there have been efforts to pass legislation or decision packages or funding packages that require districts to increase staff allocations and ratios for school counselors, nurses, social workers, you know, students and staff safety personnel and things like that. It'd be an interesting question, you know, the degree to which that kind of, as we call them in Washington State, decision packages, which is when a state agency puts together a proposal for the legislature to consider for a funding proviso. You know, so you could potentially do that. And then the question would become, you know, where would those individuals come from? You know, how would you actually recruit and get them into those spots? But if you paired that with, as our superintendent of schools in the state said to us in a meeting we had with them, you know, given the way Washington State works, local control, dearth of workforce, this challenge with this new kind of managed care structure you've got, the thing you might want to fight for in the short term, and this was before COVID, is, or right at the onset, is a quality structure or a quality rubric that every district has to evaluate itself against with respect to tier 1 supports, so that they would perhaps then at a local level do some of those things that Mark was referring to around examining how they braid their resources or allocate them to tier 1 school-wide kind of efforts. So that, you know, in our state, for what it's worth, that was direct from the superintendent of schools. Like, it's not going to be a magic allocation of resource. We can't make folks do these things, but you might be able to push through an expectation that some sort of MTSS rubric or framework or evaluation is something that every district has to do periodically, where they at least examine what they're doing at all the tiers.
Yeah, I think it's back to the critical role of the state agency, right? And you have a core group that's guiding this child and adolescent work. And do you have the public health agency as a partner? Back when we had the tobacco settlement, for example, the public health agency in Maryland allocated a lot of dollars to school mental health for the school mental health clinicians to do the anti-smoking classroom presentations, because there's no one else to do it. So we kind of took on a different role to access some prevention dollars.
Yeah, it'd be an interesting question whether these, you know, recovery plan dollars could be allocated to just a statewide kind of, you know, investment in that kind of cross-agency examination of what can we do with these and other resources to achieve something that's comprehensive and research-based, such as interconnected systems framework, MTSS, et cetera. What's our strategy going to be, and just quadruple down on the state level infrastructure that gets built.
Mark, I'm curious about the example in Baltimore City. You said there was a transparency in the accountability. So do you mean the money that they all contributed together, or do you mean in their, so they kind of did they have an economist come in? Was there like a return on investment where they could kind of track the investment and figure out if it made an impact on outcomes. Can you talk a little bit
Well,
more about that?
Yeah, so, and again, Nancy Lever would be a good person to pull in. So it's kind of a pie chart. Most of the dollars came from the education system, then mental health, then public health, then the mayor's office. Just having an overall strategic plan for expanded school mental health in the city to ultimately be in all the schools. And I think they're up to more than 100 of 150. But also in the memorandum of agreement for clinicians to receive dollars, they needed to be engaged in prevention activities as part of the contract. And so there might be, let's say, 7 community mental health agencies providing services, quality monitoring of what they are actually doing to receive those funds, as well as all of the advisory board members knew who was putting in what and how the funds were being utilized by each agency. I do think pulling Nancy into this conversation, Mark Sander, would be a good idea.
Awesome. Thank you.
One other thing that's occurred in the pandemic is that, you know, community providers that or entities that provide, you know, kind of wellness and universal efforts in schools doesn't have to be mental health provider agency staff or individuals, but, you know, we've worked with NAMI to do their Ending the Silence training, which is a really innovative kind of program, mental health literacy program that's delivered by a NAMI representative paired with a near peer to high school students who struggle with mental health issues. And, you know, there's an expectation that there's also going to be a school representative who's committed to following through on any kind of subsequent self-referrals by students. So, you know, again, in the absence of a comprehensive framework, you know, expending dollars to entities, family organizations like NAMI, mental health, you know, kind of advocacy organizations who have models like that and can come into schools and do something, but that at the very least push a little bit on the critical interconnected questions like, okay, we can come do these 1-hour things from classroom to classroom, but there's going to be an expectation that there's a way in which you have resourced up the response that might occur when students self-identify after having heard more about how what they're feeling may very well be a mental health problem.
Wow.
I'm not sure if Ending the Silence is just a NAMI Washington program or not, or if that's next.
We have a project, Eric.
Yeah.
We're connected.
Yeah. Okay.
Bye, Linda. Thanks for joining us. Good luck.
So sorry to leave. Thank you.
Yeah. And
I have a question, and I don't know if I'm way off base or maybe I missed something when I was chewing earlier, but you know, one of the things that I'm wondering, and I haven't even had a chance to talk to Catherine about this, but would a wise use of some of this one-time money be to support implementation of whatever we have available to implement, instead of always thinking about what's missing and how we can fill in those gaps? Because if it's one-time money and we want to be digging deep roots and create something that actually lasts. And so one of the things that I've been rolling around in my head and did pitch a little bit, I don't know where it's gone, I know it made it a couple of steps up, but is, you know, should we actually invest some of this money in coaching and consultation and either a community of practice or a learning community or something that really helps people say, okay, who is available in your community? Because there probably are people who they're not using, and how can we get them to the table? And maybe to do a little bit of piloting of, okay, we'll give you a little bit of funding so that these clinicians can attend tier 1 meetings. And guess what? Maybe it will be, as we think it might be, a gateway for referrals. So it'll come back to you in spades, and then you won't need our funding in the future. But to really help schools that are teetering on the edge really put some deep roots in place that can then grow and flourish. And And it just seems like that might be a good investment. I'm not on the education side. For those of you who don't know me, I'm very much on the behavioral health side. So it's very easy for me to armchair quarterback. And I'm curious to know what that sounds like to anybody else.
I think it's a phenomenal idea to invest in coaching because we know we just don't have enough coaches. And that if you could do that in a way where you documented impact so that to promote greater sustainability, I think that's a phenomenal idea.
Yeah, I mean, that's essentially saying you would invest in interconnected systems framework, or, expanded school mental health, however you want to phrase it, having some sort of comprehensive 3-tier model that demands that busy building level or district level people take time to take stock of what they're doing currently, what they need to improve, build those relationships with community providers, with the NAMIs and the family organizations. I mean, that would be very important. I think and it would be nice if it was done in a way that also could connect to a source of resource, whether it's these kind of currently available federal pool of funds. So, these coaches and trainers will be available. Those who are, ready to take advantage of it now, great. If it's next year, that's fine too, right? So let's just get as many folks as possible who are ready to engage in this kind of work at a district or building level to start doing it with these folks who are leading them through the process. And if there was periodic points at which gap filling could be resources that are needed, could be identified that align with their plan, that's based on the assessment of where they're at using the ISF implementation or installation inventory or the MTSS inventory or whatever, then great. You're basing it on a really thoughtful process of understanding what your current strengths and needs are and saying, okay, this is how we're going to invest.
Hi, everybody. I met with the superintendent and a dad who lost his son last July, college-age young man who committed suicide. And the dad asked if a high school student could join our conversation. So the players were the MDE team, the dad, a senior in high school, a young woman, about what we might do. And the dad had done a really nice job of talking to legislators. The NAMI resource and the Ending the Silence sounds like a great fit. As I listen, I can connect with parts and pieces. And in Michigan, we're looking at mental health funding that's not available for coordination and doesn't support attendance on an MTSS team. I'm at the state level. It is my job. I've built relationships since ISF for the last 2 years with community mental health folks, but I talk baby talk when it comes to the funding. And so I find myself feeling really frustrated and happy in this meeting in that I'm getting coherence about how people are talking, but I don't understand. I know the design I'm advocating for. I don't have the fiscal literacy to articulate how people might think differently. How do I build my own capacity to make the fiscal connection? Because intellectually, I'm not having a problem with the content. I'm having a problem with the money.
I think you highlight Lisa? I think you highlight an issue that probably every system contends with, which is there are too few policy wonks who really get into the funding and understand the mechanisms. In Baltimore City, we had a couple of those, and we really built an amazing thing from having a couple people that really understood how the state dollars come in, what all the different streams are, how they come into the local jurisdiction, what are the rules, where's the flexibility. I think most of us probably, I feel like I'm inadequate to figure out some of these funding issues. We need more of these policy wonks in the discussion, frankly. I don't know who among us would self-identify as a policy wonk, not me. Kim Yannick, I think she's really good in Virginia at doing that.
Well, just the questions you just laid out, Mark, like I was going to try to furiously write them down, but then realized that we're recording. But I mean, just having, you know, making sure we've got the right people around the table, to Lisa's point, when we're having that conversation and dialogue, who understand all of the things that we just don't know what to ask or prompt for, just to have a list of what should we be asking as somebody that's trying to interpret what's going on and move it to using this ISF model. What would we say? What, you know, just having that would be great, I think.
I also think, Lisa, I don't know if you can relate to this, but it does also feel like there's such an urgency, right? This money, if it's not already deposited in accounts, it's coming quickly. And I mean, I'm even trying to follow in my own kids' district. It literally tells how much in the newspaper. And I've graciously been allowed to be on their mental health committee. And so I'd certainly love to have some thoughts about how they might wisely utilize their dollars, yet it feels like you're too late before it even gets started, the conversation, right? So, you know, I think there's a little bit of that piece, as well as we're trying to influence decisions that are happening, you know, for our team, at least with the states and districts that we're connected to. Do other folks have questions or thoughts?
I think the other piece that, Lisa, I think at least I feel like a lot of the people we work with feel is that they, again, I think the points have already been made, but just want to highlight it again, is that we feel so helpless because it feels like it's happening fast, it's happening to us, and we don't have input into these conversations until you're working with a school or you're working with a district, and all of a sudden they're like, we've got $1 million and we need to spend it in the next 3 months, and help me do that, right? So I feel like we're always at that end, rather than the end of trying to say we've really got to do things differently.
You gonna maybe let us go early, Kelly?
I did tell Susan that was the goal. And honestly, we went about 20 minutes long last month. So I feel like we do owe the group back.
Yeah, for sure. Let me see if are there any new resources that we were going to share, Kelly? I feel like there's a new resource every day. Well, one thing we did want to mention is that the PBIS Center is doing a wellness campaign, and I'm not sure if anybody is on Twitter. I'm not sure how much data is there, because we invest a lot of time in social media, but I don't know what the data is that, that lets us know if it's making an impact. So it's kind of frustrating, but we've been asked to have it. So follow the wellness campaign that we have launched from our Center on PBIS. One of the things we're trying to do is one tip a day, one thing a day that we can invest in wellness, and try to make it really simple, like to what extent are we greeting kids? And then we've got that greeting resource, positive greeting resource. So we're really just trying to give one really simple strategic thing to do each day and create a pattern of routines that shape wellness. So in the For What It's Worth Twitter sphere, we'd love for you to retweet and get some of the resources that have been developed through the center out. We've also highlighted other things from the center. And then I know Eric Kelsey, while we were on the call, just texted the new return to school document that I think is really helpful. So we'll make sure you all get that access to that. Are there any other resources? oh shoot, that's not going to help you. That that might be helpful at this point, or somebody want to highlight or geek out about?
I'll just interject to say thank you, Eric and Mark, for your time today. We greatly appreciate it. I think this has been a really rich dialogue and discussion. And as Susan said, I too will want to go back to the recording to pull out some nuggets moving forward.
Well, we know Lucille will be doing that on our behalf. So
will.
we'll just have Lucille get the nuggets out, and then, hi, Lucille. I know you're listening out there. Well, thank you. We will give you the gift of time back. Again, thank you to Eric and Mark and for each and every one of you for joining today. I hope you were able to get a resource or get an idea or something that helps your tasks. Have a great weekend.
Take care,
Hey,
everybody.
Susan,
Susan.
before we
Yeah.
go, actually, I
too.
am not sure that what you put up there we can get to. Hang on, I'm trying it right now.
Oh, you know what? It's in one of